So let me give you a few wrap-up thoughts about what you've heard today. This was our 5th Stakeholder Summit, and it may be the most optimistic one we've ever had. You've heard from dozens of your colleagues who are making HIE happen, and we're seeing information exchange making an impact on providers who are working with each other in their daily care of your neighbors and friends, their patients. We started our day viewing an exciting new video that will be posted on our website for you to use that features Californians who are already benefiting from HIE. I think we all have those people in the back of our minds as we problem solve our way through the complexities of how to make HIE sustainable for the long term. Our first summits a few years ago featured a lot of technical talk about the mechanics of connecting. It was about being enthralled with the technology and the IT. And today we are hearing more from the people on the front lines who are making HIE relevant to patient care, who are having conversations with patients about permitting to have their information in an HIE. These people, including the providers, many of you who are taking the lead in your communities to establish HIE, are taking risks to get there. Clinicians like Richard Seidman, who leads his medical group into a new technology, eConsult, even though he knows his colleagues may be resistant about it. The eConsult program is reducing the amount of time county clinic patients in Los Angeles have to wait for a specialist referral. We're seeing exchange moving beyond the mainstream to touch the patients who are harder to reach, those who live hours from metro areas, those cared for by the safety net, and those with behavioral health needs. Rich Swafford, one of our state's bold innovators, shared with us his experience of appearing on our summit stage 2 years ago and how exciting it is to see how things have changed in that time, how much has been accomplished. And I have to tell you, someone said to me, "Did you pay Rich to say that?" And I said, "No. And if I'd asked him to say it, he wouldn't have done it anyway." So he did that completely on his own, and he spoke about how California is showing how innovation and collaboration can move us past old barriers. This collaborative spirit extends into the rural reaches of California. We heard from Jim Howenstein about the commitment of a group of Sacramento Valley individuals who have carved out time every 2 weeks to sit down and work out the mechanics of a new HIE with no startup seed money for those first 2 years. We heard from innovators on patient permission who are finding practical ways to partner with patients and get their approval for the records to be shared. And they're finding that California's consumers want exchange as much as we do. Even with an opt-in model, which we expected to be the most administratively difficult, San Diego's Rady's Children's Hospital has seen tremendous participation by the families of its patients, with fewer than 2% declining to share children's records for care. Our partners in public health are working hard to make registries more user-friendly and are envisioning truly amazing futures for the information they collect. Mike Hogarth asked us to open our minds to consider the possibilities of Project Inspire, which builds on all we've accomplished in HIE and reimagines the way we maintain and share information about serious disease in a revolutionary way. Your success in making HIE grow in California creates an infrastructure that makes many other things possible, including the use of big data. How big is it? It's really big. To make all kinds of improvements for the healthcare system. You're changing healthcare. We heard one example from Tom Williams from the Integrated Healthcare Association about how they are using a Cal-OHI grant to build much simpler ways to gather quality data from providers. And we watched that map of California light up as we moved from 1996 to the present. HIE has accelerated across our state, and I know that that's going to continue. It is my honor and privilege to serve as your Deputy Secretary, Health Information Exchange, and I thank you for the trust that you've placed in me and your state and federal partners to move this effort forward. I hope you have an incredibly successful future, and I wish you to go out there and make HIE happen. I will see you around California.